Welcome to Section 2 of Understanding Your Long-Term Disability Benefits. In Section 1, we introduce long-term disability benefits, typical contract provisions, the relationship between the insurer and the employer, and some statistics about LTD benefits. We also introduced Nora, who we will follow throughout the presentation. In this session, we will explore the early stages of accessing LTD, as well as the middle part of the LTD journey, or what we might call staying on LTD. The content to be covered includes contact with the insurer, as well as the insurer's need for initial and ongoing medical information. Let's jump in. The majority of people receiving long-term disability benefits return to work. In fact, according to research by Spelt et al., about 62% of people who have had cancer return to work. And according to the Canadian Life and Health Insurance Association, the average length of an LTD claim is just over 2 years. The following timeline illustrates the beginning, middle, and ending of a typical LTD journey. We've discussed that LTD begins after the elimination period has finished. In the early stages of an LTD claim, the insurer is seeking medical information that confirms the diagnosis, the present treatment, proposed treatments, and how the employee is coping. The insurer should outline the responsibilities of the employee to provide medical information as requested and respond to contact from the insurer, such as returning phone calls or responding to letters. The insurer may also consult directly with the treating physician for more information. It's not unusual for the insurer to contact the employee every couple of months for an update report. As treatment progresses and nears completion, the insurer will start to take a deeper look at the medical information, possibly having more frequent contact with the employee or requesting more information. There could be consultations with the physicians and experts to determine if the employee continues to be eligible for benefits. As well, the employee may be nearing when the definition of disability is changing from previous occupation to any occupation, and that often results in a deeper review of health information. Later in the LTD journey, the employee will be moving forward, returning to work. This could include a gradual return to work or remaining on LTD benefits if the employee is not well enough to return to work. There are times when an insurer does suspend or terminate benefits. This is rarely a surprise to the employee. Usually much discussion has occurred prior to this happening. More about a potential suspension or termination of benefits will be discussed as well in upcoming sections. I'd like to go back to our case scenario with Nora, who has been diagnosed with cancer and is having to leave work to start treatment. At this point, Nora knows she will require several treatments combined with time for recovery, but not any specific dates yet. All she knows is that she has lots of tests and doctor's appointments. She's very anxious and worried and will be having her first surgery in the next couple of weeks. She has to leave work to focus on her health. Nora's benefits state that her elimination period is 120 days and that she doesn't have short-term disability. So she needs to access employment insurance sick benefits first, which pays for a maximum of 15 weeks at 55% of her previous income. Unfortunately, like so many cancer patients, Nora begins to immediately experience the loss of income as a result of cancer and leaving work. Nora will keep her employer posted about her health situation, and closer to the 120-day mark, she will start to initiate a claim with the insurer for LTD benefits. Just one point, Nora does not have to tell her employer about her particular illness, that she's been diagnosed with cancer, but she does have to inform her employer about her ability to work or not work. Nearer to that 120-day mark, the insurer will determine what information is needed to start her claim. That could be just a conversation with Nora directly, possibly the insurer speaking directly to her physician, or having Nora's physician complete a medical report. With everything in place, Nora's LTD claim should be ready to start right after the end of the elimination period. As part of the LTD process, your insurer will be seeking medical information to satisfy your claim application. The insurer has a policy that states what the definition of disability is, usually that the person is incapable of pursuing their own occupation. So the insurer will be seeking medical information that confirms you are too sick to work at your current occupation, and hence you meet the terms of the contract. If you were previously on short-term disability, there might already be medical information about you on file. If you weren't on short-term disability, but were on employment insurance sick benefits or were paid by the employer directly, then the insurer would not have any concrete evidence and will be seeking medical information. To start that process, the claims specialist will have an in-depth conversation with you. The claims specialist will probe for details on the present medical situation, such as the diagnosis of the illness, the doctors involved, and what treatments are on the horizon. It could be that the claims person is satisfied from the conversation that with treatment starting, there is enough information to start the LTD claim. It could also be that the claims person needs more concrete information, specifically from a treating physician, and may ask you to have your physician complete a medical report. The insurer could send the report either to you or the physician to complete and return. The claims specialists have had training and experience in understanding illnesses and disabilities. They also have access to medical resources to help them understand the medical terminology, as well as having information on the general course of treatment and the typical healing times as benchmarks of how long a person may need to be away from work. On an ongoing basis, the insurer needs current information in order to ensure that you continue to meet the terms of the contract, meaning that you are unable to perform your own position due to illness, you are still under medical care, and you are complying with the recommended treatments. The insurer will want medical updates that include present and proposed treatments, prognosis, and clinical or pathology reports. They will want to know more about how the illness and treatments are impacting your life and your ability to perform regular tasks. If you are improving or nearing the end of your treatment, the insurer will want to know about that too. One point that is important is that the insurer is seeking objective findings. Medical notes, clinical findings, pathology reports. Those are all examples of objective findings. When you are on long-term disability, you will have ongoing conversations with a claims specialist at the insurance company. To help you respond in the best way possible with the insurer, I'm going to provide you with some practical suggestions that will help for your discussions. For example, in recounting your health, your treatments, your recovery, and what's in the future, it is good to be very specific with information. Give lots of details, and be concrete with facts. Tell as much information as is relevant. Be sure to include information about other health concerns that are impacted by the cancer or possibly made worse as a result of the cancer treatments. Be sure to focus on giving examples of your worst day, as it's the worst day that keeps you from being able to work. In order to receive ongoing LTD benefits, the insurer is going to maintain regular contact with you to ensure you continue to medically qualify under the terms of the contract. The claims specialist might contact you every couple of weeks to every couple of months, depending on the medical circumstances. That's a fact. It is their job to stay on top of all the LTD cases. On top of wanting to know how you are coping, the insurer will try to get a sense about how you perceive your illness. Research has found that people who see their illness in a more positive manner are generally more able to manage it. So how does someone perceive cancer in a positive manner? Well, that's more of a glass half full kind of mindset, where you are not feeling too helpless or hopeless while going through your treatment. Not only do those who have a positive mindset cope better, they are usually more engaged with the world and might be more likely to return to work as soon as they are able. And lastly, the insurer will want to learn more about your motivation. Are you motivated to stay active? Are you doing everything possible in order to stay well? Things such as eating right, resting when needed, and sleeping the right amount? If you are having trouble coping, whether that is physically or emotionally, are you trying to find the right professionals to help you? Are you getting out in the world and keeping in touch with friends and social events? All of these point towards your level of motivation to face these challenges. So if you're speaking with your insurer, you might notice that the claims specialist is asking questions about you as a person, more than just the objective medical facts, how you perceive your illness, how you're coping, and how motivated you are. These are all indicators about how well you might manage your treatments and recovery and could help you to transition back to work when you are able. It's time to check in with Nora again. Nora and her claims specialist are staying in touch as her treatment is progressing. The insurer is requesting both objective medical information as well as learning more about how Nora is coping with her cancer journey. The claims specialist is setting the schedule for ongoing contact and letting Nora know when updated medical information will be needed. The claims specialist will also be probing more to learn about how Nora is coping, what strategies she is using to cope, how she is viewing her circumstances, and possibly making recommendation on ways to manage better. That's it for Section 2. I hope you found it helpful. I hope you will join us for Section 3 of Understanding Your Long-Term Disability, Staying on LTD.